Hi, everyone. Thank you so much for joining our January Kapnick Strive webinar. Today, we are going to be talking about thyroid health. In our discussion today, we're going to be talking about what the thyroid is, what it does, so its functions, some common thyroid problems, and how to keep your thyroid healthy. Starting out with what exactly is the thyroid? So your thyroid is a small butterfly-shaped gland that everyone has, and it's located at the base of the front of your neck. For men, that's about just below the Adam's apple. It is part of the endocrine system, which means that hormones are produced by the thyroid gland, and those hormones have a really significant impact on your health, affecting all aspects of your metabolism. Like I just mentioned, one of the thyroid's primary jobs is to produce thyroid hormones, which helps regulate the way our body uses energy, which is also known as that process of metabolism. This works by your thyroid gland releasing hormones into your bloodstream, and then those hormones will travel to the various organs and help regulate the metabolic process. So when I talk about metabolism, a lot of times the first thing that comes to people's mind is weight management or weight loss. And in actuality, it encompasses a lot more than just that. Metabolism is how your body converts calories and oxygen to energy, and that energy is used for vital bodily functions, including, but not limited to, some of the things that are listed on this slide. Things like our breathing, heart rate, our body weight, muscle strength, menstrual cycles, cholesterol levels, etc. Any imbalance in the thyroid hormone production and activity can put you at risk for some physical and physiological conditions, which we'll cover later in the slides. As I mentioned, everyone has a thyroid, which means that thyroid disease can affect anyone. Men, women, infants, teenagers, and the elderly. It can be present at birth, or it could develop as you age, often occurring after menopause in women. So although it can occur in anyone, there are groups of individuals who may be at a higher risk of developing thyroid disease. You might be at higher risk if you have, one, a family history of thyroid disease, if you have a pre-existing medical condition, especially autoimmune disorders. For example, type 1 diabetes would fall into that category. For people with type 2 diabetes, that risk is a little bit lower, but still there. So again, just checking in with your doctor, regularly testing for thyroid issues if you are at higher risk. Some other risk factors would be if you take a medication that's high in iodine, if you are older than 60, especially for women, and if you have had treatment for a past thyroid condition or cancer. So here we've provided a list of some common thyroid disease symptoms. As you can see, there are quite a lot already listed here, and this isn't an exhaustive list either. So some overall signs would be, if your body shows signs like fatigue after a full night's rest, stress, anxiety, depression, weight management issues, even with regular diet and exercise, those are some telltale symptoms of a thyroid disorder. On the left side, some symptoms of an overactive thyroid would again include that anxiety and nervousness, weight loss and rapid weight loss, in an enlarged thyroid gland or a goiter on your neck, muscle weakness and tremors, light menstrual periods or it's stopping completely, feeling sensitive to heat or vision problems. And then on the right hand, an underactive thyroid might include some symptoms like feeling tired, fatigue again, gaining weight, forgetfulness, frequent and very heavy menstrual periods, having dry and coarse hair, having a hoarse voice, or experiencing an intolerance to cold temperatures. If you do experience any of these symptoms, and especially multiple of them in combination, that's when you might want to speak to your doctor about doing some testing on your thyroid. When these symptoms are left undiagnosed and untreated, it can lead to further chronic heart conditions, vision problems, and eventually could lead to thyroid cancer. Again, if you do suspect you have a thyroid condition, please check with your physician for the right treatment plan. Okay, so we talked about some symptoms. Now we're going to talk about some common thyroid problems. So there are various types of thyroid disorders, but the two most common ones that we see are hyperthyroidism and hypothyroidism. These, again, are some common symptoms that occur with each diagnosis, but it is not an exhaustive list. So with hyperthyroidism, that indicates an overactive thyroid that produces too many hormones. This is where we see that rapid weight loss, weakness, heart palpitations, anxiety, insomnia, missed periods, and intolerance to heat. Hyperthyroidism could be caused by a variety of different conditions. Of course, if you do have the risk factor of having a family history, but it can also be caused by conditions like Graves' disease, nodules, thyroiditis, and too much iodine. Hypothyroidism, on the other hand, is caused by an underactive thyroid that isn't making sufficient hormones. So it's the more common of the two. It is more common than the hyperthyroidism where it's overactive, but the hypothyroidism can trigger fatigue, weakness, body aches. We see the weight gain more often, hair loss, dry skin and hair, and then a heavy menstrual flow as well. This can also be caused by, some different conditions. Family history, of course, is a big risk factor, Hashimoto's, thyroiditis, and iodine deficiency. Additionally, either of these thyroid conditions can occur during pregnancy if the pregnant individual has too much or too little iodine in their diet, or if they have a pre-existing thyroid issue. All right, at this point, I'm going to hand it off to our other wellness coordinator, Lexi Judkins. We're going to continue with some common thyroid problems.
Awesome, thanks, Emma. So these are some other examples of conditions that can be both caused or be caused by thyroid disease. Starting with goiter, it's an abnormal enlargement of the thyroid gland that can cause coughing, difficulty breathing, hoarseness, and difficulty swallowing. As you can see on this slide, there's a picture of, looks like a bulge. Even this is a mild case of goiter. If you just Google goiter, you can see some of the extreme cases of what it looks like. Moving on to the thyroid nodules, and this is a condition where there's an abnormal growth or lump that's formed in the thyroid gland. That's typically harmless, but if it does get worse, it can cause difficulty breathing, difficulty in swallowing, and sudden weight loss. Going on to thyroiditis, which is the swelling or inflammation of the thyroid gland. And symptoms of thyroiditis depends on the type of thyroiditis and the phase of thyroiditis. And it can lead to thyroid cells dying and or lead to the over or underproduction of the thyroid hormone, which can lead to not producing enough hormones to help maintain that body's metabolism that we talked about earlier. And then finally, cancer. Thyroid cancer, it's the abnormal cell growth in the thyroid gland. Thyroid cancer is common, especially for women, as we talked about, but there are very high survival rates. And as we talked about, some causes of cancer could be family history, constant exposure to radiation, a diet low in iodine, or gender. And please note that this is not an exhaustive list of the common thyroid problems. There are many more, but we just listed a few. So let's talk about the numbers. Thyroid disease is very common, and there's an estimated 20 million people within the United States have some type of thyroid disorder. And up to 60% of people with a thyroid disease are unaware that they have this condition. And as we've been saying, women are 5 to 8 times more likely to be diagnosed with a thyroid condition than a man. And then if we look at this on a global spectrum, iodine deficiency alone affects 2 billion people with a B globally. So sometimes thyroid disease can be difficult to diagnose because the symptoms are easily confused with other conditions, such as anemia. And you may experience similar symptoms when you are pregnant or aging, or you would when developing a thyroid disease. But fortunately, there are tests that can help determine if your symptoms are being caused by a thyroid issue. There are blood tests, imaging, and physical exam. So starting with blood tests, these are used to measure the levels of the thyroid hormones that are present in our blood. Imaging tests such as ultrasounds are pretty common, and they can see the size, shape, and any potential growths on the thyroid. And then physical exam. Your healthcare provider will do a health physical inspection on your neck to see if there's any growth or enlargement of the thyroid. So what are the treatments? So your healthcare provider's goal is to return your thyroid hormone levels to normal. And this can be done in a variety of ways, and each specific treatment will depend on the cause, the type, or how far along your thyroid condition is. But some treatments include medication, and these can stop hormone productions or help control symptoms. We have radioactive iodine therapy, and this treatment damages the cells of your thyroid, preventing it from making high levels of those thyroid hormones. Or surgery. Some cases, thyroid removal may be necessary, but patients taking thyroid replacing hormones for the rest of their life if they do have to get their thyroid removed. So how can we support our thyroid health, even now or if we have a thyroid condition? There are some that we're going to list right here. So first, starting with diet. Limit or avoid your intake of processed foods, trans fat, especially a high-fat diet, refined sugar, preservatives, and dyes. And opt for more antioxidant-rich fruits, vegetables, whole grains, lean protein, beans, probiotic foods, heart-healthy fats, and omega-3s, such as fatty fish, extra virgin olive oil, canola, sunflower, safflower, groundnut, coconut, avocado, and nut butter. Woo! That's a long list of things that you can do. Other nutrients like selenium, which are found in sunflower seeds, Brazil nuts, which are very high in selenium, tuna, crab, and lobster, and also vitamin B12, which are found in foods like dairy products, fortified cereals, nutritional yeast, sardines, salmon, mollusks, liver, or muscle meats can help maintain that good thyroid function. And living in the US, most of us eat a regular diet that has adequate levels of iodine. But those typically on restricted diets, especially vegetarians and vegans, are at much higher risk because there are quite a bit of vegetables that are not a rich source of iodine. But we can find iodine sources in iodized salt. Sea salt does not have high levels of iodine just because of the process that it is. Also, other sources of iodine include seafood, seaweed, kelp, dairy, and whole grains. But overall, eating a well-rounded, balanced diet and avoiding any unnecessary diet restrictions offers the best strategy for your overall diet. Moving on to exercise. Low-impact exercise especially is beneficial for those with a thyroid disorder or who are at risk of it. As joint pain is one of the side effects of thyroid disorder, low-impact exercises like walking make a more suitable exercise option for this group. And various studies have proven that thyroid hormone levels improve with exercise and minimize the various symptoms like hypothyroidism, like low energy, weight gain, muscle loss, and depression. Also, limit exposure to toxins. Some common culprits are excess estrogen, fluoride, chlorine, heavy metals such as mercury, or chemicals that are found in non-stick cookware, flame-resistant and waterproof fabrics. Also, stuff found in soft plastics and fragrances, canned food tins, and also stuff found in antibacterial soaps. So while it's impossible to absolutely avoid these completely, especially the world that we live in, The aim should be to limit your exposure as much as possible if you have a thyroid condition. So making those smart choices, such as choosing fresh produce over canned and frozen, storing foods in glass or porcelain or steel containers over plastic, and then keeping your home ventilated can help you enjoy better thyroid health. Also, health exams, regular doctor checkups can help you identify any symptoms early on and correct them with the right treatment plan. So the USPSTF concludes that the evidence is insufficient to recommend for or against routine screening for thyroid disease in asymptomatic adults. However, the American Thyroid Association recommends measuring your thyroid function in all adults beginning at age 35 and every 5 years thereafter. So if you suspect something is wrong, please, we highly encourage you to speak with your doctor. Some other ways to support your thyroid are getting sufficient amount of sleep and reducing your stress. But overall, the important message to focus on here is to focus on a general well-being rather than one specific thing. So eating nutritious foods, exercising regularly, managing your stress, and sleeping adequately. So I encourage you to look at your current lifestyle and see where there might be an area you would like to improve. So now we're going to talk about how to perform a thyroid self-exam. And you can do this while you're at home. And it's pretty quick and easy. So the only tools you'll need is a mirror and a glass of water. So to do a thyroid exam, you're going to want to start by identifying where your thyroid is located. And generally you'll find the thyroid on the front of your neck between your collarbone and Adam's apple. So in men, the Adam's apple is much easier to see, but for women, it's usually easiest to look from the collarbone up. And the gland in the women is typically larger, and this will increase with pregnancy as there's more hormones produced in pregnant women. And the thyroid sits around the front of the neck, lying against and around the front of the larynx and the trachea. So you're going to want to tip your head back while looking in the mirror, and then look at your neck and try to hone in on the space you'll be looking at once the start of the exam. So once you're ready and once you have located your thyroid, you're going to take a drink of water while your head is tilted back. And watch your thyroid as you swallow. And during this test, you're really going to want to look for any lumps or bumps that might appear that you may have not noticed before. And you may also be able to see them when you swallow the water. So repeat this test a few times to get a good look at your thyroid. And if you see any lumps or bumps, please reach out to your healthcare provider. And if you still don't see anything and you do have a concern, reach out to your doctor and they can perform a physical exam to see if anything is going on. Well, we just sped through that, didn't we? Well, I first want to thank everyone for attending today's presentation. We really hope to see you next month at our February monthly webinar on health disparities and understanding your risk, which will take place on February 23rd from 12 to 12:30 p.m. Eastern Standard Time.